Hi, my name is Emma Sullivan, and I'm working on my case study 3 for SPCE 611, section 813. My case study is on Katie, who is a 3-year-old girl diagnosed with autism spectrum disorder. Katie lives with her older sister Gracie, baby brother Easton, mom, dad, and grandma. They are a Hispanic family that live in a suburban neighborhood. Her family is fully involved in her life, and Katie currently struggles with communication skills and social interactions. She is able to understand simple instructions, however, she struggles to express her wants and needs, which often leads to her having tantrums, headbanging, hitting, and biting. Her parents are more and more concerned with her behaviors, and they want to improve her social skills along with her communication skills. And so we conducted a functional analysis, and it has been determined that the function of her behaviors are escape and attention. The skill that we targeted for today is to use functional communication for Katie to request for help when it is needed. This can be defined as using words, phrases, gestures, or pictures to appropriately request for help with a task or a non-preferred activity when needed. Phrases that could be included are help please, I need help, can you help, or signing help, or we're just going to use an FCT card that has the phrase help on it. Mastery criteria is when Katie can independently request for help 80 to 100% of the time over at least 5 separate sessions consecutively. An example would just be Katie's mom asks her to pick up a toy, and Katie says, help please, to have her mom help her. Or she shows her mom the FCT card that states the word help. She can point to it, show her, pick it up. And then the purpose of this is to have her independently request for help when it is needed. Items needed are just natural environment or FCT cards that state help, or her reinforcers, which we will conduct a reinforcement preference assessment before beginning. Katie is engaging in something where she may need help. Ensure that the FCT cards are near her. If independently requesting for help, immediately provide reinforcement, whether that be either verbal praise or a physical reinforcement that we have found out from the earlier assessment. If Katie does not request for help or engages in problem behaviors, immediately begin a prompt hierarchy of least to most prompting. So the schedule that we have selected is least to most because Katie can independently do things. She can use some phrases. If she does not immediately request help, begin using the following prompt schedule. We have it starting with verbal, and then if she still is not requesting help on her own, we move down the hierarchy. So we begin with verbal, and we verbally prompt Katie by saying, say help if you need help, or point to the FCT card and show her that she can point to it. Next would be gestural, so we point to the help picture to indicate that Katie can ask for help. Visual is the next step, so we would then show Katie the help FCT card. And then the next step would be modeling. We would then demonstrate how to properly do the correct response. So we would say, if you need help, you can show us or point to the FCT card that says help, and then, or say help, and then help. Partial physical would be we gently guide Katie's elbow towards the FCT card if she's still not listening or using it on her own. And then the last step in the hierarchy would be full physical. So we would then fully guide Katie's hand to pick up the FCT card and or have her point to it. So by the end, you would have her either pick it up or point to it or come bring it to us, or she can sign help or verbally say help. There's a lot of different ways that she can request for help, but the end goal is just to make her communication skills and individuality better. The overall goal from her parents is to improve her communication, and by her being able to ask for help when she needs it, this would help in turn reduce her head banging, her tantrums, her hitting, her biting, because all she really wants is help, and she's having a hard time relaying that message to her parents, and instead she's acting out. But if we can find a way for her to communicate that she is needing help, then she will no longer turn to tantrums or the hitting. If she can say help or show her mom that she needs help, that would be a better way for her to communicate. And also, this is just a way for her to learn how to use her words or gestures as well as phrases, and it can be used by her parents, her therapist, people at school. Like, it is very generalized. And yeah, and as soon as she does it independently, then we will reduce the prompt hierarchy and provide reinforcements for her as well. Thanks.